limitations when it comes to recording for ultra long term, which basically is the spatial resolution. So when you want to record every day for months or years perhaps, it should be very discreet, it should be very unobtrusive for the patient. And therefore, the device we're using is a small wire that is inserted underneath the skin, and it's stitched up, and then you have a small external part you need to wear as well. And that gives you only 2 channels of EEG. And usually in the hospital, you would perhaps have 25 channels distributed over the entire scalp. So the spatial resolution is not the same. And therefore we say, okay, before you implant our device, you need to have a good understanding where it's relevant to monitor your patient. If you have that, you can get really, really good signals from that area. But of course, the rest of the scalp, if something pathological happens there, we might miss that. So that would be my main limitations with the ultra long-term devices. There are a lot of unanswered questions still. The number of trials are still limited with few patients. We need to show that it has a direct clinical benefit, that the outcome for the patients is improved when you use these devices and get the objective measures. So I think that's very much what we focus on now, showing the efficacy and showing the value of using these devices. So I'm definitely biased here, but I think it has some huge potential. I really believe this is a tool in the toolbox of the physicians, the neurologists, the epileptologists, that is missing. We see in cardiology, they've had the loop recorder for 20 years or so, but we haven't had the same kind of continuous recording in neurology. And I believe this can really be a game changer to not only understand what is going on in the EEG in a snapshot, but on a longer time, and analyzing how the changes can really benefit not only the patient, but also just the physicians themselves, that they can trust that what they're doing is really helping the patient.